When the government announced this scheme, they said it's going to be as simple as anyone who qualifies for this scheme, for them to just walk into an impaneled hospital and avail any kind of secondary or tertiary medical care they might need to the tune of about $7,000 US. And the government is using the data from the 2011 census to identify those families who are economically poor and will need this kind of medical assistance from the state. And this particular scheme is going to entail a budget of about $1.6 billion this year, and that's going to be shared about 60-40 between the federal government and the states that have signed up for it.
And are there going to be state practitioners in terms of the medical providers? Are they going to be employed by the state, or will people be able to walk into a private healthcare facility? Will they be restricted to the geographical area they live in? How about those details?
So what the government essentially says it's going to do is it's going to build 50,000 new medical centers over the next few years, and those are going to be crucial to dispensing that kind of medical care we're speaking of with regard to the Modi Care scheme, as it's being popularly called. But in certain cases, there have been private institutions that have signed up for this as well. The federal government has told them that we will take on the responsibility of ensuring you get reimbursed for the care you provide under this particular scheme. In fact, that's been one huge cause of concern that's been expressed by private institutions, saying we've partnered with states in the past. The reimbursement of funds isn't always on time, but they're saying they're willing to give this a shot because of what this scheme aims to achieve. But in the beginning, primarily, I'm being told that it'll be the government institutions that most people who qualify for the scheme will have to rely on.